Ladies and gentlemen, my name is Jason. You're welcome to Jason's Room. Hey. This is a room that brings people from all walks of life, seeing life from their perspective. You get me? Not every time bants and rants and shouts and, sometimes we just want to learn. Also, unlearn if we need to. And with me, I have my childhood friend, Baba Sina. Someone I've known for a very long time. A face I've seen for a very long time. Let's say since 2002, 2002 to date. So he's a medical practitioner. His name is Dr. Gabriel. You're welcome.
Thank you very much.
So guys,
Jason, for having me.
see, we pioneer sense now. We don't try. So we've had this session a number of times, but just to unforeseen circumstances, he had to make out time, as always, to obey senior. We don't be senior before, so he the airport, he the follow. It's good to have you, brother. And so today we're just going to go straight to the point, not to waste time. There are lots of myths that surround the thing people dread the most, which is HIV. And I want you to give light to that and also break things down to a Ibom state. And I'm going to start off with just asking you as it is HIV not man-made? And if it's man-made, if it's true that it's man-made, why did the person create that thing? Why?
Oh, this question joke. Well, I don't know. Is there any disease that is not man-made? Like the Bible said, as long as we are in this world, through sin came sickness, and through sickness came death. So as long as we keep living in this world, in this mortal flesh, I'm speaking like a Christian, there will always be sickness, there will always be infirmity, and there will always be death. But as a medical practitioner, well, I don't know if HIV and AIDS was man-made, but it's with us here, and we are with it, and we are. This is where we are. This is where we are.
So let's talk about your starting, like when you're trying to become a medical practitioner, and you're saying, okay, you want to concentrate on this HIV part. Other parts of this your medical field. I don't know the terms, but didn't it scare you, like stuff like that?
Okay, thank you very much. So the departments and the field of medicine is quite broad. So we have those that actually want to be in the academia, those that actually want to do clinical medicine, work in the hospital. We only have those that want to lecture as well. And then we only have the public health space, which I actually belong. Okay. Right from when I was in year 4, I already told myself, this is the space I want to belong. Okay. I think it only extends from the background that my mom was a public health nurse. Yes, I used to follow her for all these health talks, outreaches, and the rest. So yes, it became of a very important interest to me. So public health physicians, we don't just focus on only HIV. There are many diseases of public health importance. HIV is just one of them. Okay. Other popular ones are the COVID, malaria, typhoid, tuberculosis, and the rest. So HIV is just one of the diseases of public health importance. So I was not scared. I mean, why should I be? It's something I had passion for.
Okay.
Yes.
So on the myths that surround HIV, are there things you would need to speak up on here that, there are many myths that surrounds it. You see to us on WhatsApp out of fear. You see someone doing anonymous and say, a lady saying, I have HIV, I've slept with 40 guys in this class and they are going to contact HIV. Is it true? Like, give light on the myths that surround it.
Okay, this HIV thing, we've heard it right from secondary school, from primary school as well. Information and awareness has been spread adequately. So I think there's virtually almost no one currently, a youth and adult, that has not heard about HIV and AIDS. So demystifying the myths that you've mentioned, well, I saw that stuff on WhatsApp status about a girl actually posting an anonymous message that she has slept with people and they're infected. She's not 100% sure. Did she go back and, was she the one that carried out the HIV test on the people she slept with? And it's not possible. So one, Women, unfortunately, if you look at the statistics of people that are living with HIV and AIDS, women actually lead the pack. They are more prevalent. Their numbers are more prevalent amongst people living with HIV and AIDS.
Why is that?
For various reasons. So one, the health-seeking behavior of the female is actually better than that of the males. That is true. A woman can come to the hospital even for the slightest thing as headache. And maybe during the hospital visit, she does a routine test, because the HIV test is actually free in hospitals. And by chance, she actually knows that, oh, she's been infected with the virus, and then she starts treatment. Before you see a man in the hospital, he be say the sickness don't knock calm, don't push him for ground, he don't swallow anything when he wants swallow, and there's been no remedy. And say, oh, finally, hospital and the last resort. So that's one. So we have more women coming to the hospitals, and so when they come to the hospitals and test, definitely if you test more, you will get more. Then secondly, the female reproductive system is very susceptible to infection and injury. You understand? As a male, your penis actually has a protective layer. So if you don't have any breakage in this layer, if you're having unprotected sex, your chances of having HIV and AIDS are very slim. And equally to the male urethra is quite long compared to that of the females. That's why a doctor always says that if you are having maybe a match, you know what I mean by match, do not shave 1 week though. If you want to shave like 2 weeks though, because once you shave, you create that breakage in that protective lining of your reproductive organ as a man. But females, the organ is just open, direct straight to the bloodstream. So if you are infected, once your semen, even your pre-cum, contains HIV virus, if you're infected, as soon as your penis enters the woman's vagina with that pre-cum, straight, she can have it. But as a man, if you observe everything I've said and the protective lining of your penis is intact, even if you sleep with 3 women that have HIV and AIDS, so far there's no breakage in that membrane. Do you understand? It's very, very, the chances of you getting it are actually very slim.
So on a scale of 1 to 10, a woman who doesn't have HIV but is having intercourse, unprotected sex with a man who has, the tendency of her having is like
9 over 10.
Yo.
Then if on the other way around, it might be 3, 4, 5 over 10. So you can actually see the risk is more on the women than the men.
Yo, that's whoa. So when you said, there's something you said that the more you test, the more you find out.
Yes.
So that brings me to ask you, because as of July, we were number 3. We're number 3 in the whole country. So does that mean that we test more? It's just that we are
promiscuous.
Promiscuous.
It's a misconception. I don't think Aquariumites are more promiscuous than any other tribe or any other state in Nigeria. Is the fact that statistics was done as at 2018, and the prevalence was 5.5 in Akwa Ibom State, making us the 3rd in Nigeria. Like I said, if you don't test, you will not get the numbers, you understand? And we actually are blessed with a government that has interest in health right from then, and the presence of other implementing agencies, other NGOs that actually, working on this HIV implementation in the state is actually commendable. So right from that time up till now, work has been done in Akwa Ibom State. I'm sure if the same level of effort was put in all the states of the federation, I don't think we will actually be leading the pack or being 3rd. It's because work is being done here. If you're looking for water, you have to drill a borehole. And when you drill the borehole, you have water. If you don't drill the borehole, you will not have the water. That is just the truth. So that being said, I'm sure with the amount of work that has been done, the awareness created, the provision of free treatment and medications to people living with HIV and AIDS. As of 2018, I think about 40 to 50,000 people were on treatment in Akwa Ibom. And that number is to about 100,000 currently, which is actually a good thing. Because many people back then had the virus, but were not on treatment. But now, those that have the virus know their status, and they have been linked to treatment, and they are on treatment, and many of them are actually virally suppressed. And as long as you are virally suppressed, you cannot transmit it. Even if you're having unprotected sex, you cannot transmit it.
So you're literally debunking the fact that the so-called promiscuity in quotes is because probably other states are not taking measures like
That is
Akwa
just
Ibom
the
State
truth. That
is.
is not the truth. So by the time, I'm sure by the time the people that did those statistics come back again, I assure you, the prevalence rates of HIV in Akwa Ibom would have dropped, because with the medications we have, we've actually been able to prevent new infections from emanating. We've actually tried to prevent mother-to-child transmission. So you can actually see, with the advent of our medications, you can actually see children are being born negative to positive pregnant women. So you can see even if the mother is positive, the child is born negative. Even the husband self is negative.
So much passion in when you're talking. You don't even be like person we want jackpot, like medical practitioner we want jackpot. I see the passion you talk about Akwa Ibom, HIV with things. You're one of the few guys that I've known, aside you being my geo, like for a medical practitioner, everybody wants to jackpot. People that were even doing, let's say, Christian religious studies, they went back to go and do nursing, want to jackpot. Would you advise anyone like in Nigeria to jackpot? And what's up with all the strikes? Would you even want to jackpot yourself?
Where do I start from? Okay, strike. You know how the government be. Not be say the country too bad. I just think that we just have an ill luck with the bad leadership and then corruption at the upper echelons of power.
Yeah.
So I think if you go courtesy visit, give federal government, state government, okay, it's always at federal government level.
Yeah.
I think the only way then they ever listen to you now, if you go strike, down your tools. I'm not saying that I'm always happy when the strike happens. And to clarify it now, when they say strike, it's not all the doctors that actually go on strike.
Oh, okay.
Doctors under the state government employee don't go on strike.
Okay,
You understand?
okay,
Because
okay.
yes, those ones I don't think they equally have any issue. Especially Akwa Ibom State. Akwa Ibom State is doing extremely well.
Okay.
Then the doctors where they go on strike now, doctors under federal government employee, and those where they do residency. So you say Association of Resident Doctors, and then they like go strike.
Okay.
You know, go ever hear say consultant go strike, because those ones they are being paid well.
Yeah,
Their
okay.
welfare packages are attended to well.
Okay.
So while this set of doctors go on strike, they are the workforce, the major workforce
Okay.
of the tertiary and federal government institutions in the country.
Okay.
And the work they put in is not commensurate with their welfare packages. This year we've lost over 7 doctors who died in the line of duty.
Jeez.
Over work, over stress. And the thing about Japa is, once this people Japa, you know, if maybe there were 3 doctors in a unit, you'll now be left with 1. And that one will cater to all the patients in that unit. And the work stress and everything overwhelms that particular person. So you can actually see the Japa thing is having both a positive effect for those living and negative effect for those that stay
Staying
back.
behind.
So we are actually advocating to government. Not be like say all of us want Japa. I keep saying that the grass can be greener where you water it. But then again, if there's no water, how do you water it? So this is where the government have to actually provide the water for us to water it. Increase the welfare packages for we, the doctors, or other healthcare professionals, because not only doctors, nurses are equally japaring,
Yes.
radiographers are japaring, pharmacists too are japaring. So provide the basic amenities, increase the welfare packages, so it will be more lucrative for people to actually say, okay, let me stay back and save my fatherland. Let me stay back and actually pursue a career in clinical medicine or residency. Let me stay back and actually help the people.
Yeah.
I think statistically, Nigeria has one of the poorest doctor-to-patient ratio. I think the World Health actually says that it should be 1 doctor to 1,000 patients. I don't think that is even much. In Nigeria, it can be 1 doctor to 100,000 patients. I'm telling you the gospel truth. You will see, if you go to a basic teaching hospital, clinic day, you see like 3 doctors consulting. Go to the waiting room, you will see patients lining up. The same level of commitment and service delivery a doctor will give as at the beginning of his clinic will not be the same as at the end when fatigue, hunger, and tiredness sets in. And that might affect patient quality, it might affect service delivery, and it might affect the quality of medical care you provide to your patients. So these are many issues. Next thing is for the government to actually provide more hospitals, more manpower. When you provide the hospitals, you have to actually provide trained personnel to actually man these hospitals. Many people in the rural areas, they still don't have access to a nearby health facility. You understand? They have to trek long distances to get to a facility. So it all boils down to funding on the government, provision of the basic amenities. Like my people who don't japa, like they tell me about seeing the basic things in hospitals over there, things that don't cost much, but it's just that the funding. If all this money that our politicians spend on wardrobe allowance, car allowances, and all those things are being, scraped. And all that money is channeled into healthcare and education. I think this country would actually be a better place. So the advice for people that want to japa, if you have the means, because japa costs money, it costs millions to japa. If you have the means and you've done your due diligence, nobody say you go japa now as doctor, they do delivery man. Because I heard one funny story. The consultant left here and is now doing he's delivering pizza and bread over there. In order to meet
so
up,
is it that they don't recognize our paper, or you need to do certain things to meet up their standard?
Even if you are coming from outside this country to Nigeria, ideally how it is like when it comes to medicine, because the workings of the medical profession in another country is different from.
Are you serious?
Yes, it's different. It's different. The mannerism, the way you approach patients, the availability of some sophisticated technology and other things in the healthcare sector. The recent trends in technology in the healthcare sector might not be available in Nigeria. So the way medicine is practiced in some countries is different. So ideally, whether you have a medical license here in Nigeria, if you want to practice in any country, you have to take their own medical licensing exam. Likewise, if a doctor from, say, the UK wants to come and practice here, practice, not coming as, and if so, they invite him for a 2 days outreach or come and do a surgery, he wants to practice, he has to write our own medical licensing exam. Not like most of our colleagues who actually train outside the country. Before they get the Nigerian license, they have to write the MD kind examinations. Before they do that, I think they do like 6 months in Nigerian hospital to actually learn the diseases and nothing to the diseases that are prevalent here. I know prevalent. They never yet say my UK man they complain of mosquito or malaria. So those ones are prevalent here. Do you understand? So they have to come here and do like 3-6 months in our Nigerian hospitals, then proceed to write the exam. So even if the consultants here that's going there, you have to go and write their exams and get their license before you can practice in that country.
So speaking on that, the topic you raised, like a lot of people travel, doctors travel. So apparently, not every medical practitioner who literally wants to japa will make it.
Not everyone will make it. Some will be stalled by lack of finance. Some will stalled by lack of issuance of visa. Plenty things. Some will be stalled by their village people. Problems of life. Some will be stalled by different things. Some will actually make it there. Some actually make it there and they are not even practicing medicine again. Some are cab drivers. Some are doing menial jobs. Some are even doing caregiver jobs over there. A doctor will leave you and go and be doing caregiver jobs. But again, you ask them, why are you doing this? Say, anyway, it's better than here. And you hear those kind of things, it hurts. I'm actually very sure if this country was working the way it should be working, many people that japa will not japa. Because there's some privileges and benefits you gain in your home country. Because there's no place like home. You will not see most of them, they don't speak about the racism they suffer there, the stigmatization, the bullying they suffer because of the color of their skin. They will not mention all these things. Sometimes it does make it seem that everything is just japa and all your prayers are answered. It's not true. The way some of these job people paint this thing is not true. That's why I say if you've done your due diligence, you've had your place of work, you've secured your work there, you've secured the accommodation, you've secured your money, and you know, so you are going there and it's going to be greener for you. Please, by all means, japa. If you don't want to japa, you can still make it in this Nigeria. Do you understand? We actually hope that in the due course, one day, God will visit us. So we was good leaders.
With your experience now, that thing our parents used to say from when we were in secondary school. Oh, I want you to be a doctor. I want you to like. Is it a thing in today's world? Like, do you think doctors make it, so to say?
You say
on like let's say in a 10-year span, do you think you guys get the respect and regard that's supposed to be duly assigned to you?
It's the respect that doctors used to enjoy back in the days. I would think it's eroded. Currently now there's inter professional rivalry, especially in the country. I don't know if it's just Nigeria, but I think it's mostly in African countries. Everybody wants to be the name doctor. Everybody wants to do the work of a doctor. Even doctor said on the chook eye for pharmacist work. You understand? A doctor wants to open a pharmacy. A pharmacist wants to open a hospital. Nurse want to do surgery. You understand? So everyone is just, there's no boundary.
Yeah.
You see doctors training nurses in their hospitals, calling them auxiliary nurses so they can pay them a chicken fee instead of actually employing actual registered nurses and paying them what is their due. You see pharmacists opening consulting rooms in their pharmacies so that they will not send the patient to see a doctor and follow due process, trying to cut costs. So you can see everyone is just trying to overlap each other's work. Even among the doctors, if you see someone that is a surgeon doing the work of a physician, someone that is a physician that has a private hospital want to do surgery, you will not call someone that is skilled in that particular surgery just because he wants all the money to himself. So there is this lack of regulation. You can even see, if you stay by this plaza, you see people hawking herbal products that damage people's kidneys on a daily basis, but they're hawking it, what should I say, unapologetically. They're hawking it without the fear of God, even when they know these things do more harm than good. I keep telling people, if you see a product and it's lying that it can cure more than 3 diseases, please, it is fake. There is no one drug that can cure more than 2 or 3 diseases. But you see one product, they're hawking it. It will cure diabetes, hypertension, fibroid, staphylococcus, gonorrhea, HIV. What kind of drug is that one? If that kind of drug exists, the hospital should be obsolete by now. So you see all these problems, all these things I'm talking about, actually, it has made the medical profession lose its relevance. Doctors are not really given that respect anymore. I understand. So it's the thing of pride that was there in the profession. It's gradually being eroded in this part of the country. But outside this country, everyone knows their place. Doctors know their place. Bam. Even among the doctors, different specialties among the doctors know their place. Anywhere you stop, you refer to the next person if it's not your field. Pharmacists know their place. You understand? The nurses know their place. The lab scientists know their place. You see, you go to a lab, a typical lab here in Uyoye. The person will just do the result for you and then prescribe drugs. It's not supposed to prescribe drugs. Ideally, when someone is ill, the right channel is you go to the hospital, you open a folder, you see a doctor. A doctor asks you some questions based on your presenting complaints, examines you if necessary, and then sends you to go and do some laboratory investigations. You come back with that result, and then from the result, he can now go ahead to prescribe medications for you to get in the pharmacy. But you see, it's the other way around. Someone have an illness, jump to pharmacy, go and swallow medications. If it's not working, you jump to lab, go and do lab. I've not done a test, make I go do test. After that, you give the lab man, say, make him interpret the result for him. Lab man go interpret, go prescribe drug, go meet pharmacy. In fact, some pharmacies say they even get lab, say for their same building self. Say, go do test, bring the result, come. Prescribe drug, give you. Understand? Just everybody just now when everything don't choke, you know, come work. You can't remember, say, that's true. Make I go see one doctor like that. That is it. But it's not supposed to be like that. It's actually a modus operandi, which is not really flowing here.
Thank you, Dr. Gabriel, for coming to Jason's room. Before I let you go, the revelation in this your field has been is much. You get plenty things where people go learn. Before I let you go, would you jackpot?
Yeah. $1 million question. Even if I jackpot, I will definitely come back to Nigeria.
Yeah.
Definitely. Yeah. I actually want to see a Nigeria where things work out.
Yeah.
That we actually can beat our chest and say, yes, we are proud to be Nigerian. I'm proud to be from Akwa Ibom. And even if I jackpot, it could be maybe I won't go further my education, go learn 1 or 2 skills that is not available in the country, and then learn it and come back here and equally train other people with what I've learned. Use what I've learned to actually impact the lives here.
One more thing, sorry. I wanted to ask you, how often should we even visit you guys?
You mean the hospital?
Yeah, how often?
Well, I would think at least once a month. Basic. There comes a time in your as an adult when you clock a particular age where you should actually, be having an appointment with your physician. Say at least once a month, not kill it out of 30 days, just say one day, just do the basic checkups. And then for an adult, you should actually know the diseases that have been prevalent in your family.
Okay.
If your father had hypertension, your father or your mother had diabetes, or any of the cancers, or has any chronic illness, you know that you are at risk of coming down with those illnesses. For example, if your dad had hypertension, you know that, okay, my dad had hypertension, okay, I'm at risk. What are the risk factors? Obesity, lack of exercise, increased salt intake, sedentary lifestyle. So you now watch out for those risk factors and avoid them. You understand? You reduce your salt intake, be more active physically. You understand? And be checking your blood pressure. If it's diabetes, the same thing too. You cut down on junks, you eat healthy, cut down on carbohydrates. I'm not saying you should like really eliminate it, because as an African man, I think our meals are mostly carbohydrate. Gari rice, bread, bean, rice, bread, yam. Almost everything contains carbohydrate. Even beans contains carbohydrate. So you cut down and regulate and watch out to all those things. If maybe someone had cancer in your family, like they said, early detection is actually key. If you feel like a woman, if one of your family members had breast cancer, you always do self breast examination, examine for lumps and anything. If you notice anything abnormal, you visit a doctor. So at least if you can just do at least a medical checkup at least once every month or once in 3 months, it's actually the ideal thing to do.
Thank you very much, Dr. Gabriel. It was wonderful having you in Jason's room. Love to have you again another time so you give more light on your experience. Thank you very much,
Thank you
brother.
very much for having me.
Sorry for all the inconvenience.